Next, for today's perspective, we're going to look deeper at the work the UN Children's Agency is doing on the ground in Gaza. UNICEF says more than 400 children are killed or injured every day. Senior staff on the ground say they've never seen so many children so badly injured in a conflict in decades working for the organisation. And a grim projection too from the organisation saying up to 10,000 children under 5 could soon be affected by child wasting, the most threatening form of malnutrition affecting infants. Today's perspective guest is a UNICEF spokesperson, Tess Ingram, who I can join now. She's in Jordan, in Amman. Good to talk to you, Tess. Let's begin and talk about the current situation your staff are facing on the ground in Gaza.
Yeah, thanks, Gavin. I got out of Gaza just over 24 hours ago. I was there for a week working with the team to better understand the situation on the ground. And there is no way to describe it but appalling. The conditions that people are living in, particularly around Rafah, where there are now over 1 million people displaced. They're living in makeshift shelters and tents. It's incredibly cold and wet. It's been raining a lot this past week, and there's just not enough food and water to go around. Almost every family that I spoke to told me about their struggle to find enough food to feed their children or to get enough clean water or even winter clothes. A lot of the children left the north in October when it was warmer and don't have jackets or even enclosed shoes. So people are exhausted and they just want this war to end.
When we look at the situation, trying to report on what's going on, given that international teams cannot go in to Gaza at Israel's behest, you can briefly go in as part of what you call embeds briefly, or with the Jordanian military camp. I think one team got in for a few hours. Just what do you think is being underreported? That you saw on the ground, walking around. You talk about the lack of food, lack of water. What struck you emotionally, strongly, just spending the time there?
Two things I think that people aren't really discussing. We are talking a lot about malnutrition and disease, but two things that I think are really important for people to consider is we talk about half of the population of Gaza being children. That doesn't really sink in until you see how many children are there. It is children walking around the streets, sitting in makeshift shelters, playing with their friends, trying to find a way to pass the time. So there are so many children on the streets of Gaza and in incredible need at the moment. And then the other thing I think that's really important for us to remember is the more hidden toll on children, the mental health aspects of this war. Children are frightened. They've been displaced several times. They don't know what's going to happen next. And mothers told me terrible stories of children's behaviour changing, of their sleeping changing, some children no longer speaking at all. And I think, Gavin, if we think about a normal conflict, maybe a child would experience 1 or 2 instances of trauma, but then generally people flee to safety. And that is not happening in the Gaza Strip because there is nowhere safe for people to go. So day after day, children have this repeated trauma.
It is hard to comprehend. I remember being with your team and Médecins Sans Frontières team as well in Misrata in Libya, covering the conflict there, looking at the situation for children. But given that your staff are saying, and you're saying this is something that you haven't come across, the scale of this is something else. Tell us about how much food, how much water, an average child in Palestinian territory in Gaza is able to access a day.
So in terms of food, the main food that's available to families at the moment is bread. You see long lines for queues at bakeries, but families are also thankfully now managing to get their hands on flour. So there's lots of little kind of makeshift ovens popping up where groups of people are pooling resources, making bread and sharing that amongst the community. Other than that, people's access to food is incredibly limited. There is now aid coming in. Almost every family that I spoke to told me about eating tinned food, tinned meat, tinned vegetables that are coming from aid packages. But access to fresh fruit and vegetables is incredibly difficult. So it's bread and it's tins at the moment. We did a survey of 2,000 children under the age of 2, and 90% of them were only getting 2 food groups. And for the most part, that was bread and breast milk. So that's just not enough nutrition for a growing child's body. So we're incredibly concerned about the impact there in terms of malnutrition. And then in terms of water, we've said, 1.5 to 2 litres of water is all a child who's been recently displaced in the south has access to in a day, which is far below the recommended emergency standards.
I read that NASA Hospital is one of the main centres where aid organisations are able to give some food out and basics to people sheltering there. I'm trying to understand the system of basically when you're there, how you're giving food out. Are you using some of the UN shelters? Are they just full all the time? How many people are forced to sleep out in the streets? I was talking to journalists, for example, who are based there, saying that they've been all clubbing together, sleeping in tents most of the time, surviving and reporting in between.
It really is a patchwork of plastic. Like, if I can paint a visual for you, Gavin, it's when you walk down the streets, it's almost unrecognisable that it's a busy kind of main street of a town. It's now just bits of tarpaulin and rope and blankets strung together, and people are living big extended families in small spaces. So maybe a 2x2 makeshift shelter has 15, 20 people all huddled inside, sharing a couple of mattresses and blankets. So it's incredibly crowded. There are designated shelters that are being run by the United Nations where people are going. But for example, one of those, the Khan Yunis Training Centre is what it's called, that has capacity for 3,000 people, but there are 30,000 people there setting up makeshift shelters around the designated building. So that's the extent of the displacement, and it makes it easier for us to get aid to people because they're all in the one place, but also challenging because it's so crowded and there's such need. We're really only still getting in a trickle of aid compared to the needs.
So clearly aid needs to increase massively. Tess, really good to talk to you. We'll speak to you in future on the programme, no doubt. Tess Ingram, spokesperson for UNICEF in Jordan.